The world's first streetlights were put up in Kimberley, but today this is hardly the center of innovation and technology. It's really just a big hole. Well, think again.
At MNet, we are very committed to social responsibility. We do all our programs under the umbrella of MNet Cares. When I heard about what was happening in Kimberley, at the Kimberley Hospital, I felt compelled that I had to come.
What was so compelling to bring MNet CEO Patricia Scholtemeyer to Kimberley, or the chairman of BHP Billiton, Dr. Xolani Mkhwanazi? It was to witness a miraculous transformation of this rundown ICU into a state-of-the-art paediatric ward. Another milestone in the Carte Blanche Making a Difference campaign.
It was like moving from a third world to the first world in 2 months.
Every day, Dr. Peter Jooste does his rounds at the Kimberley Hospital Complex. He's a soft-spoken paediatrician who until recently was the only one in the public health system for the whole of the Northern Cape. That's an area larger than Germany. If a child is in serious trouble in this province, more than likely they'll end up in Dr. Jooste's hands.
This is a 128-bed pediatric hospital, so it's a very big department. Basically, I need about 2 more colleagues. So at the moment, you're sort of triaging the whole time to decide which is the most critically cases to attend to.
What he needed more than anything was a decent, well-equipped ICU. What he had was an old, cramped general ward and a shortage of ventilators and other vital equipment.
One often has to improvise because of lack of equipment, and the care, therefore, is suboptimal.
And these are the children that challenge Dr. Jooste and his team the most. They are the fighters. Life for many of them is hanging by a thread. He knew a new ICU would give more of these children a better chance. Dr. Michelle Muller is a first-year registrar and one of Dr. Jooste's senior doctors.
I think we always had the staff, I think we had the motivation, but we were struggling because we couldn't actually deliver the kind of service that we want to.
The answer to Dr. Jooste's prayers would come from an unlikely source, the manganese mines in Hot as Hell owned by BHP Billiton, and a television program campaign that had identified hospitals in need. The Kimberley Hospital was originally not on the list, but Tsidi Ramohase and Nomfundo Mqadi from BHP Billiton would soon change that.
We are very privileged to have been selected as one of the hospitals being a beneficiary of this process.
CEO of the Kimberley Hospital Complex, Gordon Muncho, had just landed in his new job when the offer of 5 million rand from Carte Blanche and BHP Billiton arrived on his desk. It was an offer he simply couldn't refuse, and he was soon chairing weekly meetings to get the project rolling.
The preliminary sketches that we have seen about the type of facility that we'll be getting, in fact, I can't wait for the end of this project to wheel in the first baby.
The whole pediatric area was old and run down. This is what the old ICU looked like before the patients were transferred and the construction team moved in. To create space, the architects would knock down a wall to join these 2 rooms. Their plan was to eliminate the straight lines so the ward was less sterile and depressing for the children and the staff. When the project started, this hospital was drab and uninspiring. But for the painters, the installers, the builders, the floor people, the pressure wasn't just to make it beautiful. In 2 months, there was bustling, hammering, chiseling. The race was on. And all the pressure landed on the shoulders of project manager Hilton Schwenk, who along with the architects, the quantity surveyors and the engineers all gave their services pro bono.
Get on with the job, these are the parameters, and that's your deadline to finish it. And that freedom of activity, the freedom of ability to move and make decisions within seconds, literally, helped us achieve our deadline within the 8 to 9 weeks.
For the planners, collaboration was key, and the staff and even a patient or 2 made suggestions. 15-year-old Sammy is a diabetic patient who's been in and out of ICU many times.
They did ask me what must they put in and what, and I told them TVs, paint the colors, blue and yellow and orange.
He was very clear to suggest that the nursing staff should not eat in front of him because it upsets him, because they never had a tea room. ICU should have its own patient bathroom. He wanted a television, so all of his primary wishes have been met.
Hilton had his work cut out for him, managing a building site on the 4th floor, down a corridor past the patients. 2 of the main lifts were being replaced. The hospital was full, and at times, too many contractors were sharing the space.
That was extreme, to say the least. We're working in 150 square meters of floor area, and at one point we had something in the order of 10 contractors, all trying to do their own bit.
While the ICU was under construction, new equipment was starting to arrive. The GSI Ordera machine was something head of audiology Annelies Steenkamp had only dreamed of.
When you were told this is now something that's going to become available, what was your reaction?
Jumping up and down. We've been waiting for this machine for over 4 years, so we're very excited.
The machine sends a series of sounds through the ear and then measures the brainstem response. Previously, children would be put on a waiting list to be tested in Bloemfontein, possibly delaying their language development.
If they are on the waiting list and we don't have this machine, they're just going to slip through the system. If we test them with this machine and we can fit them with hearing aids, they have a chance of normal speech and language development.
Eventually, late last year, Mr. Munch's big day finally came.
So this is it?
This is it, Bogdan. This is our paediatric ICU for Kimberley Hospital Complex. I don't know whether I should say this, but when I walked in the first time, I couldn't help myself. I just saw tears rolling down because of the good work and the goodwill that went into this.
And if Gordon Moncho was in tears, the nurses were simply overwhelmed. New equipment was everywhere, and 4 brand new monitors would mean that Dr. Uester no longer needed to make difficult choices about which patient was more deserving. Polyfloor donated the colorful floor. Sammy had got his TVs, and the doctors were learning how to use their new touchscreen. It was clear that even George Mazarakis, Carte Blanche executive producer, a difficult man to please, was impressed. Sizani Maketa has been nursing here for 11 years.
You know, working here, even if you come being depressed or down, just the entrance, just the setup, the colors and everything, your spirit you feel uplifted and you feel motivated to work and tackle the tough work that we're doing here with the very ill patients.
We hadn't been there long when we saw the real value of the nurses' station, designed to provide a clear view of every patient.
As we were filming, this baby lost a lot of oxygen and has had to be resuscitated. The real business of this ward is saving lives like that little baby.
Ruth Sitebe has worked as a pediatric nurse here for 12 years.
It helped that they could see it in time. Because if they went there, the patient would have gone into a respiratory arrest.
Alberto is one of Dr. Michelle Muller's favorite patients. Since we filmed him, he's had an operation to help him breathe easier. And after 4 days in ICU, he's doing well.
What we now have is what we need to be able to save these lives, that we can actually offer the care that the child needs.
The old ward was uncomfortable for the mothers. Now there are new reclining chairs bringing them relief as they spend hours in ICU willing their children to live. Studies show that a mother's presence has a profound effect on the health of her sick child. Ursula Mwahi and her daughter Hope have been test driving the new chairs.
Has it made a difference?
Baie. Hoe meer ek sterk is, hoe meer word die kind ook mos nog sterk ook nog.
Hope is now 3 months old. She has pneumonia. A mere 500 grams at birth, she now weighs 1.6 kilos. She owes her survival to the brand new ICU. In January, Premier of the Northern Cape, Hazel Jenkins, shared the podium with other dignitaries at the official opening.
I also wish to take this opportunity to applaud the collaborative and laudable efforts by Carte Blanche and BHP Billiton to make constructive contribution towards improving our health system.
Together, the Premier and BHP Billiton's chairman, Dr. Kolani Mkwanazi, unveiled the plaque, and Patricia Scholtemeyer did the honours.
I've never seen so much goodwill in any project that I ever was involved in before. It was just public, private, coming together, and everything worked.
BHP Billiton's Dr. Xolani Mkhwanazi still found time to comfort this troubled mother.
Now, you've obviously to date been our biggest contributor. Are you getting your money's worth?
Anytime you do things that make a positive impact to people, you do get your money's worth.
Billiton was the biggest sponsor, giving 5 million rand, and these other companies gave generously of either their goods or services. Soon the guests left and the dedicated staff got back to the important task of saving these young lives. Meanwhile, Mr. Moncho incorporated a new ritual into his daily routine.
I started at 7 in the morning. I first come here just to draw some inspiration for the day, because this place has literally changed the culture in the institution.